great pleasure to introduce to you Sid Ryan, President of the Ontario Federation of Labour.
Sisters and brothers, I want to say first off a big thank you to the Ontario Health Coalition for pulling together all of the healthcare workers and all of the supporters from the community to say to the three political parties that we demand that we continue to see the healthcare system funded to levels such that we all get and continue to receive a decent level of care that's delivered publicly and operated publicly in this system. My friends, that's got to be a bottom line for each and every one of us as we move towards this election. We need to be able to discern for ourselves who exactly is speaking for healthcare in this province. And let's examine the record for a moment. You know, when the Tories were in office, they had a grand scheme. It was called Local Health Integration Networks. That's what he wanted to bring into place. Unfortunately for all of us, an election took place and they got defeated, and they were unable to bring in that agenda. Well, my friends, just like Tommy Douglas says, you can elect white cats or you can elect black cats. This time we elected some white cats, we thought, the Liberals. And what did they do? They brought in Linds. My God, the very thing that we fought the election on, where Labour got in behind these parties, what did they do? They brought in local health integration networks, and they're sucking literally hundreds of millions of dollars in bureaucracy out of the healthcare system, away from the frontline workers, away from the frontline caregivers. So seriously, let's think long and hard and examine all these platforms, because, you know, yes, there's a drive with everybody talking about austerity programs. You have this Neanderthal here in Toronto, Bob Ford, talking about shutting down long-term care facilities and selling them off to the private sector. That somehow austerity has become synonymous now with saving money in the system. When in fact we all know that when you start to privatize, take a look at the hospital in Brampton. Take a look at that hospital, which cost $500 million more than what was forecast in the initial stages. They moved it into a P3 hospital. They have less than half the beds that they said they would build under the old hospital and the old scheme in the public sector. So it's a misnomer to say that somehow if you privatize we're going to save money. And if you want any further proof of that, take a look at the United States, where they spend 14% of their GDP on healthcare, and there's 40 million Americans do not get access to a healthcare system, as opposed to here in Canada, where we spend 9% of GDP, and every man, woman and child in this country is covered by the healthcare system. So my friends, as Jack Layton says, don't let them tell you it cannot be done. Yes, we can deliver good quality public health care in this province. We can do it with frontline workers earning a decent wage and a decent salary, and they should be able to retire with a modest pension plan to boot. We can do that, my friends. And you make sure when this election rolls around, each and every one of us, each and every single person here influences 5 people in their life. And when you multiply that times 250,000 healthcare workers in Ontario, you're talking about more than 1 million votes. And when you put that together with the 1 million organised workers in the Ontario Federation of Labour, you're now talking over 2 million votes, my friends, enough to persuade and to win any election in this province. It is time we came together. It's time that the Labour movement came together. We need to stop the division in the Labour movement and get in behind a common cause, like healthcare, for example. Every single worker out there, no matter what union you belong to, they want to see a united Labour movement, that we're taking on the governments. That's who we should be fighting, my friends. Let's fight government for good, decent healthcare in this province. That's something that we should be demanding of ourselves, as well as demanding of politicians. So, as we carry on, my friends, as we get closer to this election, keep in mind those 5 those friends of yours, those family members that you influence, and ask them to vote in support of public health care, publicly operated health care in this province. Thank you very much.